On this video, we are going to have nursing board exam type of questions. I'm not just gonna give you board exam type of questions na lumabas noong mga nakaraang taon, but I'm also gonna give you the rationalization that will cover your fundamentals of nursing practice. If you wanna know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create nursing educational videos to help nursing students and nursing professionals with their studies. If that's something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that out. Subscribe now. You hit that notification bell so that you will be the very first to watch me when it's uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video, nurses. Kumusta kayo? Ano mga ganap nyo? Welcome back sa channel ko. Gusto ko lang ulit magpasalamat sa inyong lahat sa patuloy niyong pagsuporta sa channel ko. Sa mga bago nating subscribers, maraming salamat po. This video is another playlist sa channel ko where I call it Nursing Test Bank. Yes, mag-iipon nga po tayo ng mga tanong or mga questions na previous na lumabas sa board exam at hindi lang sa board exam cover yung mga previous questions na lumabas sa NCLEX at lumabas sa HAA, DHA, yung mga ganon para naman magkaroon ka ng idea kung ano yung mga common questions na tinatanong sa mga licensure examinations na yon. And don't worry because I'm not only gonna give you the questions but I'm also gonna give you the rationalization, which is I think the most important thing. Now the goal of this video is for you to understand and for us to understand why is that the right answer. Alright, so for today we are going to cover about the foundation of nursing practice, Pnle 1. Huwag ka mag-alala kasi una pa lang to. I'm gonna give you 50 board exam type of questions na lumabas ng mga nakaraang taon. I will also try to cover other topics yung sa OB, sa community nursing, sa CHN, medical surgical, mental health nursing, at yung mga iba pa nating normally na mga subjects para sa araw na yon, handa ka na. Now, medyo mahaba po ito kaya hindi ko na patatagalin pa. Without further ado, let's jump into the video. Hi everybody! Welcome back sa ating formal discussion ng iyong Foundation of Professional Nursing Practice, Philippine Nursing Licensure Examination 1. Ito yung ang tinatawag natin dito yung Pnle 1. Ito yung type 1 examination. Diba 5 yon? 5 categories yung tinitake natin sa board exam sa nursing. This is your sample questions dun sa ating Pnle 1 sa ating test 1. Normally, first day ito binibigay, hindi ba nurses? Now, let this be your nursing study guide sa paghahanda mo ng nursing board exam ngayong Mayo. Now, this video that I'm doing today is, kauna-unahang entry natin sa nursing test bank. Narinig mo na tong concept ng nursing test bank. Naalala mo kasi yung kapag sa review center, 'di ba, sa last day sa latter part ng review. Ang ginagawa, nagsa-sample taking tayo, ay nagsasagot tayo and then we're gonna do the rationalization. Now, this is our very first entry doon sa playlist na yon. So, I'm planning to create more videos, having all those, trying to cover all the possible questions that you might encounter sa nursing board exam sa Pinas, sa NCLEX, sa HAA, DHA, at kung ano-ano pang mga exam na yan. Huwag ka mag-alala kasi itong unang video na to ay para doon sa mga magte-take ng board exam ngayong darating na May. Now, hindi ko na papatagalin to kasi medyo mahaba ito, nurses. Handa ka na ba? Let's begin. Now, objectives natin, well, I have two objectives for you. First one, I will going to provide you and discuss to you board exam type of questions. And then I'm going to provide rationalization per each board exam type of questions. Exciting, hindi ba? Now, Ito, introductions to kasi this is going to be a 50 items board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer, nurses. Good luck. Bago tayo mag-start ng formal discussion natin ng itong slide na to, gusto ko lang i-take mo or malaman mo na hindi importante kung tama o mali yung sagot mo dito. Ang gusto kong i-take mo dito at ang dapat mong maunawaan at dapat mong mabigyan ng full grasp ay yung rationalization. Some of the questions in the board exam, pati yung sa NCLEX na yan, sa HAAD, nauulit yung mga tanong, naiiba lang yung itsura, naiiba lang yung form, yung mga words na ginagamit, pero technically parehas sila ng thought. Anong gusto kong malaman mo? Once na naintindihan mo kung bakit yun yung tamang sagot, mas magiging madali sa'yo yung pagsagot sa mga tanong sa board exam, kagaya nga niyan. Kaya yun lang. Okay, handa ka na ba? Okay, let's begin. Alright, first question. The nurse in charge in labor and delivery unit administered a dose of terbutaline to a client without checking the client's pulse. The standard that would be used to determine if nurse was negligent is A. The physician's order. B. The action of the clinical nurse specialist who is recognized expert in the field. C. The statement in the drug literature about administration of terbutaline. D. The actions of the reasonably prudent nurse with similar education and experience. Nurses, let's begin the 5 seconds now. Time's up na po tayo. Time's up na po tayo, nurses. Ano ang sagot dito? The answer to this question is, tingnan natin kung tama ka, letter D. Yes, the action of the reasonably prudent nurse with similar education and experience. Bakit ito yung sagot, nurses? Bakit? Ano ang rationale behind? Now, the standard of care is determined by the average degree of skill, care, and diligence by nurses in similar circumstances. So that is the rationale why D is the answer. Proceed na tayo. Next question, number 2. Nurse Trish is caring for a female client with a history of GI bleeding, sickle cell disease, and a platelet count of 22,000 units per liter. The female client is dehydrated and receiving dextrose 5% in half normal saline solution that at 150 ml per hour. The client complains of severe bone pain and is scheduled to receive a dose of morphine sulfate. Question. In administering the medication, Nurse Trish should avoid which route? Is it A, IV, B, IM, C, oral, D, subcutaneous? Avoid, negative statement. Avoid which route? I will give you 5 seconds, and that starts now. All right, nurses, we are back. The answer to this question is letter B. Why? I am with a platelet count of 22,000 units per liter. The client tends to bleed easily. Therefore, the nurse should avoid using the IM route because the area is highly vascular and can bleed readily when penetrated by a needle. The bleeding can be difficult to stop. Nako, in connection ito doon sa coagulation studies video na ginawa ko. Nag-release din ako ng video about sa normal values, mga normal lab values. I-check mo yon, ililink ko sila dyan. At pumunta ka sa channel ko, nandun siya sa playlist ng nursing study tips, nursing mnemonics, okay? Kabago-bago lang yon. Napakarami kong nilagay doon ng mga normal laboratory values, okay? Now let's proceed. Question number 3. Dr. Garcia writes the following order for the client who has been recently admitted digoxin, 125 milligrams per orem once daily. To prevent dosage error, how should the nurse document this order onto the medication administration record? Letter A, digoxin, 1,250 milligrams per orem once daily. B. Digoxin 0.1 to 50 milligrams per orem once daily. Digoxin 0.125 milligrams per orem once daily. Or is it D. Digoxin 100.125 milligrams per orem once daily? Nurses, your 5 seconds begins now. All right, time's up. The answer to this question is letter C. Why? Digoxin 0.125 milligrams per orem once daily is the answer. The nurse should always place a 0 before a decimal point so that no one misreads the figure, which could result in a dosage error. The nurse should never insert a 0 at the end of the dosage that includes a decimal point, because this could be misread, possibly leading to a 10-fold increase in the dosage. So that is why letter C is the answer. Proceed. Number 4, a newly admitted female client was diagnosed with deep vein thrombosis. Nako, nagkaroon din ako ng discussion nito, ha? Panoorin mo yung video na yon. Nasa medical surgical nursing playlist. Which nursing diagnosis should receive the highest priority? Nurses, prioritization ang tanong. A. Ineffective peripheral tissue perfusion related to venous congestion. B. Risk for injury related to edema. C. Excess fluid volume related to peripheral vascular disease. Or D. Impaired gas exchange related to increased blood flow. Your 5 seconds starts now. All right, time's up. The answer to this question is letter A. Ineffective peripheral tissue perfusion related to venous congestion. Why? Ineffective peripheral tissue perfusion related to venous congestion takes the highest priority because venous inflammation and clot formation impede blood flow in client with deep vein thrombosis. Next, number 5. Nurse Betty is assigned to the following clients. The client that the nurse would see first after endorsement. So, prioritization question pa rin to. Alin daw dito yung una mong i-attend o una mong titingnan as a nurse kasi nasa endorsement kayo? Is it A, a 34-year-old post-operative appendectomy client of 5 hours who is complaining of pain? B, a 44-year-old myocardial infarction client who is complaining of nausea? C, a 26-year-old client admitted for dehydration whose intravenous has infiltrated? Or D, a 63-year-old post-operative abdominal hysterectomy client of 3 days whose incisional dressing is saturated with serosanguinous fluid? Your 5 seconds starts now. All right, time's up. The answer to this question is letter B. Why? A 44-year-old myocardial infarction MI client who is complaining of nausea. Nausea is a symptom of impending myocardial infarction. MI, or tinatawag din nating MI, hindi ba? And should be assessed immediately so that treatment can be instituted and further damage to the heart is avoided. Gets yon? Gets. Okay, number 6. Nurse Gail places a client in a 4-point restraint following orders from the physician. The client care plan should include which of the following? Letter A, assess temperature frequently. B, provide diversional activities. C, check circulation every 15 to 30 minutes. Or D, socialize with other patients once a shift. Your 5 seconds starts now. All right, time's up, nurses. Now, the answer to this is letter C. Why? Check circulation every 15 to 30 minutes, nabubulol pa ako, restraints encircle the limbs, which place the client at risk for circulation being restricted to the distal areas of the extremities. Checking the client's circulation every 15 to 30 minutes will allow the nurse to adjust the restraints before injury from decreased blood flow occurs. So circulation, okay? So, ayan. Now, bago ko basahin yung question number 7, nurses, maaaring nagtataka ka bakit 5 seconds lang. China-challenge po natin yung ating utak na sumagot ng mabilis. First thing that comes to mind, yun. So, habang binabasa ko yung sagot, pakinggan mo na mag-isip, yung tanong, pakinggan mo na mag-isip ka na, tapos pagdating sa choices, mamili ka ng tamang sagot. Okay? Huwag ka mag-alala kasi ang point nga naman nitong ating test banking is yung maunawaan mo yung rationalization. Okay, number 7. A female client who has severe burns is receiving H2 receptor antagonist therapy. The nurse in charge knows the purpose of this therapy is to. So ano daw ang purpose ng H2 receptor antagonist therapy? Sa mga burn patients. Tama? Burns. Okay, A. Prevent stress ulcer. B. Block prostaglandin synthesis. C. Facilitate protein synthesis. D. Enhance gas exchange. 5 seconds starts now. Alright, time's up. The answer to this question is letter A. Prevent stress ulcer. Curling's ulcer occurs as a generalized stress response in burn patients. This results in a decreased production of mucus and increased secretion of the gastric acid. The best treatment for this prophylactic use of antacids and H2 receptor blockers. Okay? So, next. Number 8. The doctor orders hourly urine output measurement for a post-operative male client. The nurse Trish records the following amounts of output for 2 consecutive hours: 8 a.m. 5 ml, 9 a.m. 60 ml. Based on these amounts, which action should the nurse take? So, ano daw yung nursing intervention mo? Napansin mo na 10 ml lang yung itinataas ng pasyente mo sa magkasunod na oras, from 8 a.m. to 9 a.m. Is it A. Increase the IV fluid infusion rate? B. Irrigate the indwelling urinary catheter? C. Notify the physician? D. Continue to monitor and record hourly urine output. Your 5 seconds starts now. Alright, time's up. The answer is letter... Asa na yun? D. Continue to monitor and record hourly urine output. Normal urine output for an adult is approximately 1 ml per minute, 60 ml per hour po yun. Therefore, this client's output is normal. Beyond continued evaluation, no nursing action is warranted. This is normal. Normal po, 60 ml per hour, 10 ml per hour. 1 ml per minute ang normal value ng urine output mo, okay? Proceed. Question number 9. Tony, a basketball player, twists his right ankle while playing on the court and seeks care for ankle pain and swelling. After the nurse applies ice to the ankle for 30 minutes, which statement by Tony suggests that ice application has been effective, successful? Anong statement ng pasyente mo? Is it A, my ankle looks less swollen now? B, my ankle feels warm. C, my ankle appears redder now. D, I need something stronger for pain relief. Your 5 seconds starts now. Time's up. The answer is letter B. My ankle feels warm. Ice application decreases pain and swelling. Continued for increased pain, redness, and increased warmth are signs of inflammation that shouldn't occur after ice application. Remember, anong pinopromote ng ice pack mo? Ano yon? Our ice application mo, vasoconstrict, vasodilate, vasodilate. Okay? Alright. So, nakakasunod pa ba tayo? Hinga-hinga, ha? Okay, next. Pwede mo namang i-pause yung video na to from time to time kung gusto mong balikan yung question. Alright. Number 10, the physician prescribes a loop diuretic for a client. When administering this drug, the nurse anticipates that the client may develop which electrolyte imbalance? So, kapag nag-administer ka ng loop diuretic, anong possible electrolyte imbalance ang pwedeng ma-develop ng pasyente mo that means that you need to watch out for it? Is it A, hypernatremia, B, hyperkalemia, C, hypokalemia, D, hypervolemia? Your 5 seconds starts now. The answer is letter B. Obviously, hindi hypervolemia. Tinatanong ka ng electrolyte imbalance, pag may sumagot ng hypervolemia, shoota ka. Okay, so YB, hyperkalemia. A loop diuretic removes water and along with it is sodium and potassium. This may result in hypokalemia, hypovolemia, and hyponatremia. Remember, wherever water goes, sodium will follows. Kaya ang sagot dito ay hyperkalemia kasi sa water, kapag nilatanggal mo yung water, kasama na din doon yung potassium. Okay? So the answer is letter B, hyperkalemia. Number 11. She finds out that some managers have benevolent authoritative style of management. Which of the following behaviors will she exhibit most likely? Benevolent authoritative. Yun yung key term. Alam mo ba yon? Sasabihin ko na sa iyo mga multiple choices. Have a condescending trust and confidence in their subordinates. B. Gives economic and ego awards. C. Communicates downward to staffs. D. Allows decision-making among subordinates. 5 seconds begins now. Time's up. The answer is letter A. YA. Having a condescending trust and confidence in their subordinates. Nurses, remember that benevolent, authoritative managers pretentiously show their trust and confidence to their followers. Pretentious, the word pretentious. Kasi authoritative po. Authoritative ang iyong benevolent behavior. Benevolent type of style of management. Okay? Now, next. Number 12. Nurse Amy is aware that the following is true about functional nursing. Functional. Alin daw dito ang totoo about sa functional nursing? Is it A, provides continuous, coordinated, and comprehensive nursing services? Is it B, one-to-one nurse-patient ratio? C, emphasize the use of group collaboration? Or D, concentrates on tasks and activities? Your 5 seconds begins now. Time's up. The answer to this question is letter A. Provides continuous, coordinated, and comprehensive nursing services. Functional nursing is focused on tasks and activities and not on the care of the patients. Not on the care. It is functional nursing, function. Focus on tasks. Task-oriented. Malinaw. Number 13. Which type of medication order might read vitamin K 10 milligrams IM daily times 3 times a day? So tinatanong ka, kapag nakakita ka ng ganito, yun ang tanong saan mo kadalasan nakikita tong order na ito ng doktor? Okay? Kung malabo sa yung tanong, punta tayo sa choices. Is it A, single order, B, standard written order, C, standing order, or D, stat order? Your 5 seconds begins now. Alright, the answer to this question is letter B. Saan mo ito kadalasan nakikita? Sa standard written order. This is a standard written order. Prescribers write a single order for medications given only once. A stat order, reviewin lang natin, is written for medications given immediately for an urgent client problem. A standing order, also known as a protocol, establishes guidelines for treating a particular disease or set of symptoms in special care areas such as coronary care unit. The facilities also may institute medication protocols that specifically designate drugs that a nurse may not give. The answer is letter B. Proceed. Number 14. Nakakahinga pa ba o hinga-hinga? A female client with a fecal impaction frequently exhibits which clinical manifestations? Is it A, increased appetite, B, loss of urge to defecate, C, hard brown formed stools, D, liquid or semi-liquid stools? Ano ang sagot dito? Teka, 5 seconds muna. Ayan na. Alright. The answer to this question is letter D. Why? Liquid or semi-liquid stools. Passage of liquid or semi-liquid stools result from seepage of unformed bowel contents around the impacted stool in the rectum. Clients with fecal impaction don't pass hard brown formed stools because the feces can move past the impaction. These clients typically report the urge to defecate, although they can't pass stool, and a decreased appetites. All right, let's proceed. Question number 15. Nurse Linda prepares to perform an otoscopic examination on a female client. For proper visualization, the nurse should position the client's ear by... Is it A, pulling the lobule down and back? B, pulling the helix up and forward? C, pulling the helix up and back? D, pulling the lobule down and forward. Fundamentals of nursing ito. Your 5 seconds starts now. Oh, sorry. Okay, 5 seconds starts now. All right, the answer is letter C. Pulling the helix up and back. To perform an otoscopic examination on an adult, the nurse grabs the helix of the ear and pulls it up and back to straighten the ear canal. Pulling the helix up and back. Why? To straighten what? Your ear canal or the patient's ear canal. For a child, the nurse grasps the helix and pulls it down to straighten the ear canal. Marami pa rin na nurses na nalilito dito. Pulling the lobule in any direction wouldn't straighten the ear canal for visualization. Pag adult, helix up and back. Kapag pedya, ang usapan magkaiba. Grasp the helix and pull it down to straighten what? The ear canal for better visualization. Next, number 16. Which instruction should Nurse Tom give to a male client who is having external radiation therapy? Is it A, protect the irritated skin from the sunlight? B, eat 3 to 4 hours before treatment? C, wash the skin over regularly? D, apply lotion or oil to the radiated area when it is red or sore. Your 5 seconds starts now. Alright, the answer, nurses, is letter A. Why? Protect the irritated skin from sunlight. Irradiated skin is very sensitive and must be protected with clothing or sunblock. The priority approach is the avoidance of strong sunlight. That's why the answer is A. Proceed. Number 17. In assisting a female client for immediate surgery, the nurse in charge is aware that she should A, encourage the client to avoid following preoperative medication. B, explore the client's fears and anxieties about the surgery. C, assist the client in removing dentures and nail polish. D, encourage the client to drink water prior to surgery. Your 5 seconds starts now. Time's up. The answer is letter C. Assist the client in removing dentures and nail polish. Dentures, hairpins, and combs must be removed. Nail polish must be removed so that cyanosis can be easily monitored by observing the nail beds. Nako, pre-operative care to sa mga pre-surgery. Sa mga pasyenteng who will undergo surgery. Pre-op care. Okay? Next. 18. A male client is admitted and diagnosed with acute pancreatitis after a holiday celebration of excessive food and alcohol. Which assessment finding reflects the diagnosis? A, blood pressure above normal range. B, presence of crackles in both lung fields. C, hyperactive bowel sounds. D, sudden onset of continuous epigastric and back pain. Anong tinatanong dito? Pancreatitis. Anong assessment ang magpapatunay ng pancreatitis? Your 5 seconds starts now. Time's up, nurses. The answer is letter D. Sudden onset of continuous epigastric and back pain. The autodigestion of tissue by the pancreatic enzyme results in pain from inflammation, edema, and possible hemorrhage. Continuous unrelieved epigastric pain or back pain reflects the inflammatory process in the pancreas. Okay? Next. Ako, ang haba na. 28 minutes na, girl. Okay ka pa ba? Oh, kaya pa to. Pakinggan mo lang yung beautiful voice ko, Char. Okay, number 19. Which dietary guidelines are important for Nurse Oliver to implement in caring for the client with burns? Dietary guidelines sa mga pasyenteng sa mga burn patients. A. Provide high fiber, high fat diet. B. Provide high protein, high carbohydrate diet. C. Monitor intake to prevent weight gain. D. Provide ice chips or water intake. Subukan mo. Your 5 seconds starts now. Alright, the answer is letter B. Sinong sumagot ng D? Susuntukin ko. Charing. Next. Bakit B? Provide high protein, high carbohydrate diet. A positive nitrogen balance is important for meeting metabolic needs, tissue repair, and resistance to infection. Caloric goals may be as high as 5,000 calories per day. Next, question number 20. Board exam type of question, nurses. Galaw-galaw. Nurse Hazel will administer a unit of whole blood. Which priority information? Anong situation mo dito? Administration ng whole blood. Which priority information should the nurse have about the client? Info mo daw. A. Blood pressure and pulse rate. B. Weight and height and weight. C. Calcium and potassium levels. D. Hemoglobin and hematocrit levels. Your 5 seconds starts now. Alright, the answer is letter A. Hindi ang hemoglobin and hematocrit levels mo. Although gusto ko lang isingit, i-commercial ko lang, naggawa ako ng lab values kasama tong hemoglobin and hematocrit levels na to. Gusto mo malaman yung normal values nito? Punta ka dun sa video na yon. Nandun yon. Check mo lang yung playlist na yon. Nandun siya. Check mo yung recent upload ko. Bakit A? Blood pressure and pulse rate. The baseline must be established to recognize the signs of an anaphylactic and hemolytic reaction to the transfusion. That's why it's A. Next. Nurse Michelle witnesses a female client sustain a fall and suspects that the leg may be broken. The nurse takes which priority action? A. Takes a set of vital signs. B. Call the radiology department for x-ray. C. Reassure the client that everything will be alright. D. Immobilize the leg before moving the client. Nurses, your 5 seconds starts now. The answer is letter D. Immobilize the leg before moving the client. If the nurse suspects a fracture, splinting the area before moving the client is imperative. The nurse should call for emergency help if the client is not hospitalized and call for a physician for the hospitalized patients. Okay? Next, question number 22. A male client is being transferred to the nursing unit for admission after receiving a radium implant for bladder cancer. The nurse in charge would take which priority action in the care of this client? Is it A, place a client on reverse isolation, B, admit the client into a private room, C, encourage the client to take frequent rest periods, or D, encourage family and friends to visit? Your 5 seconds starts now. Alright, the answer to this question is letter B. Why? Admit the client into a private room. The client who has a radiation implant is placed in a private room and has a limited number of visitors. This reduces the exposure of others to the radiation. Lalo na kapag meron siya mga radiation implant, diba? Ayaw mo namang ma-expose yung mga visitors. So that's why the answer is letter B. Next. Question number 23. A newly admitted female client was diagnosed with agranulocytosis. The nurse formulates which priority nursing diagnosis. Anong prayo mo sa mga patients na diagnosed ng agranulocytosis? Nabubulol pa ako. Is it A, constipation, B, diarrhea, C, risk for infection, D, deficiency knowledge? Your 5 seconds starts now. Time's up, nurses. What's your answer? The answer is letter C, risk for infection. Why? Agranulocytosis is characterized by reduced number of leukocytes, leukopenia in other terms, and neutrophils, neutropenia, in the blood. The client is at high risk for infection because of the decreased body defenses against microorganisms. Diba? Mga ano to, ang tawag natin dito, mga differential ng WBC mo. Nag-discuss ako ng WBC studies mo, white blood cell studies mo. I-check mo yung recent upload ko, makakatulong yun sa'yo. Now, deficient knowledge related to the nature of the disorder may be appropriate diagnosis but is not the priority. Okay? Next. 24. A male client is receiving total parenteral nutrition suddenly demonstrates signs and symptoms of an air embolism. Ano ba? What is the priority action by the nurse? A. Notify the physician. Wala ka agad ginawa. Gigigil ako sa'yo. B. Place the client on the left side in the Trendelenburg position. C. Place the client in high Fowler's position. D. Stop the total parenteral nutrition. Your 5 seconds starts now. Time's up. The answer is letter B. Perfect. Place the client on the left side in the Trendelenburg position. Lying on the left side may prevent air from flowing into the pulmonary veins. The Trendelenburg position increases intrathoracic pressure, which decreases the amount of blood pulled into the vena cava during aspiration. Answer B. Question number 25. Nurse may attend an educational conference on leadership styles. The nurse is sitting with a nurse employed at a large trauma center who states that leadership style at the trauma center is task-oriented and directive. The nurse determines that the leadership style used at the trauma center is anong key term mo dito? Task-oriented and directive. Ano daw yun? Autocratic, laissez-faire, democratic, or situational? Your 5 seconds starts now. Okay, the answer is letter A. Autocratic. The autocratic style of leadership is a task-oriented and directive. Perfect. Minsan sa board exam, kailangan mo lang tingnan yung mga keywords sa mga tanong. Tingnan mo yung keywords kasi minsan definition of terms lang naman yun talaga yung hinihingi sa'yo. Nilalagyan lang nila ng situation, ng storya. Hanapin mo yung pinaka-hinahanap ng yung pinaka-key term para hindi ka masyadong malito, hindi ka malito sa mga story. Okay, question number 26. The physician orders dextrose 500cc with KCl 10 mg per liter at 30cc per hour. The nurse in charge is going to hang a 500cc bag. Potassium chloride is supplied 20 mg per 10cc. How many cc's of KCl will be added to the IV solution? Nako, mathematics, ito na to. A, 5cc. 0.5cc. B, 5cc. C, 1.5cc. Or D, 2.5cc. Your 5 seconds starts now. Medyo challenging to. Alright, so sa mga nakakuha ng tamang sagot in less than 5 seconds or in 5 seconds, genius ka girl. Ang tanong dito ang sagot dito is letter D. Perfect. Bakit daw? The answer is 2.5cc. Now, 2.5cc is to be added because only a 500cc bag of solution is being medicated instead of a 1 liter. Now, Question number 27. A child of 10 years old is to receive 400 cc of IV fluid in an 8-hour shift. The IV drip factor is 60. The IV rate that will deliver this amount is, ano tong 60 UGTTS to? Micro, macro, microset. Is it A, 50 cc per hour, B, 55 cc per hour, C, 24 cc per hour, or D, 66 cc per hour? Your 5 seconds starts now. Time's up. Answer is letter A. 50 cc per hour. A rate of 50 cc per hour, the child is to receive 400 cc over a period of 8 hours is equals to 50 cc per hour. Gets nyo ba yon? Ulitin ko ha, a rate of 50 cc per hour. Now this child, sino mang bata to, is going to receive 400 cc over a period of 8 hours. 8-hour shift. That is equal to 50 cc per hour. Okay? Next. Question number 28. The nurse is aware that the most important nursing action when a client returns from surgery is return from surgery. Ibig sabihin, post-op. Ano pa yung isa? Most important. Keywords, nurses. A, assess the IV for type of fluid and rate of flow. B, assess the client for presence of pain. C, assess the Foley catheter for patency and urine output. D, assess the dressing for drainage. Your 5 seconds starts now. Alright. Medyo may clue ka na sa sa picture. Pero ang sagot ay B. Assess the client for presence of pain. Assessing the client for pain is a very important measure. Post-operative pain is an indication of complication. The nurse should also assess the client for pain to provide for the client's comfort. Pain is the answer. Alright? So itong video na to makakatulong to sa mga visual learners natin, pati mga auditory, kasi mapapakinggan mo kung gaano kaganda ang boses ko at pakikita mo rin kung gaano kaganda yung mga video presentations natin. Charing! Okay. So nakakahinga pa ba kayo? Medyo gumalaw-galaw tayo. Hindi ko na-realize na ganito pala nakakapagod ito kasi iniisa-isa natin per tanong. Okay? So sana ma-appreciate mo yan. Kung na-appreciate mo, i-like mo na, i-share mo na ang video na to para sa mga magte-take ng board exam ngayong May at sa mga nurses na magte-take ng kanilang mga exam in the future para mas marami makalam. Tapos mag-subscribe ka na sa YouTube channel ko. Okay, support me. Alright, question number 29. Which of the following vital sign assessments that may indicate cardiogenic shock after myocardial infarction? Maisingit ko lang, nagkaroon ako ng nursing management discussion ng cardiogenic shock. Recently uploaded lang yon. Panoorin mo. Now, is it A, BP of 80 to 60, pulse of 110 irregular? B, blood pressure of 90 over 50, pulse of 50 regular. C, blood pressure of 130 over 80, pulse of 100 regular. Or D, BP of 180 per 100 or 180 over 100, pulse of 90 irregular. Your 5 seconds starts now. The answer, nurses, is letter A. Perfect. Blood pressure of 80 over 60, pulse 110 irregular. The classic signs of cardiogenic shock are low blood pressure, rapid and weak irregular pulse, cold clammy skin, decreased urinary output, and cerebral hypoxia. Alright, let's proceed. Next question, board exam type of question. Which is the most appropriate nursing action in obtaining a blood pressure measurement? Is it A, take the proper equipment, place the client in a comfortable position, and record the appropriate information in the client's chart? B, measure the client's arm if you are not sure of the size of the cuff to use. C, have the client recline or sit comfortably in a chair with the forearm at the level of the heart. Ano daw? D. Document the measurement which extremity was used and the position that the client was in during the measurement. Fundamentals of nursing ito. Nursing 101. Your 5 seconds starts now. RLE question. Time's up. The answer is letter A. Take the proper equipment, place the client in a comfortable position, and record the appropriate information in a client's chart or in the client's chart. It is general or comprehensive statement about the correct procedure and it includes the basic ideas which are found in the other options. Umbrella effect. Naalala mo yan? Ito na tayo. Board exam type of question number 31, asking the questions to determine if the person understands the health teaching provided by the nurse would be included during which step of the nursing process. Anong clue mo dito? Maaari kang malito, asking the questions to determine if the person understands the health teaching provided past tense, nagbigay ka na. Ngayon, tinanong mo siya. Tinatanong ka kung anong part ng ADPAI ito ng nursing process. Is it assessment? Is it evaluation, implementation, or planning and goals? Sasapukin kita. Your 5 seconds starts now. Time's up, nurses. The answer is B. Gigigil ako sa'yo asking questions. Baka sinagot mo dito assessment. Provided. Past tense na nga diba? Sa mo yung ginagawa, nagme-measure ka na kung nag-came across ba yung health teachings. Sa evaluation. Evaluation includes observing the person, asking questions, and comparing the patient's behavioral responses with the expected outcomes. Okay? Next. Question number 32. Which of the following item is considered the single most important factor in assisting the health professional in arriving at a diagnosis or determining the person's needs? Is it A, diagnostic test results, B, biographical date, C, history of present illness, D, physical examination? Arriving at the diagnosis or determining the person's needs. Your 5 seconds starts now. Kakatuyo pala ito ng lalamunan, girl. Char. Okay, answer is letter C. HPI, history of present illness. The history of present illness is the single most important factor in assisting the health professional in arriving at a diagnosis or determining the person's needs. C. Question number 33. In preventing the development of an external rotation deformity of the hip in a client who must remain in bed for any period of time, the most appropriate nursing action would be to use what? Anong instrument ang gagamitin mo to keep your client in bed? Is it A, trochanter roll extending from the crest of the ilium to the mid-thigh? B, pillows under the lower legs. C, footboard. Gigigil ako sa'yo. D, hip abductor pillow. Your 5 seconds starts now. Time's up. Answer is A. Ito na siya nasa picture. Trochanter roll extending from the crest of the ilium to the mid-thigh. A trochanter roll properly placed provides resistance to the external rotation of the hip. Anong affected area mo dito? Saan ba yung deformity mo dito, girl? Diba sa hip? Ayan sa tanong. Diba? So, trochanter roll. Let's proceed. Board exam type of question number 34. Which stage of the pressure ulcer, stage down ng pressure ulcer does the ulcer extend into the subcutaneous tissue? Anong stage ng pressure ulcer mo nag-extend sa subcutaneous or naapektuhan na ang sub-Q? Is it stage 1, stage 2, stage 3, or stage 4? Your 5 seconds starts now. Alright, the answer is letter C, stage 3. Clinically, a deep crater or without undermining of adjacent tissue is noted. Stage 3 ha, kapag nasa sub-Q na. Alright, board exam type of question number 35. When the method of wound healing is one in which wound edges are not surgically approximated and the integumentary continuity is restored by granulations, the wound healing is termed, definition of terms lang to nurses, wag malilito ha, wag mo siya shock. A. Second intention healing. B. Primary intention healing. C. Third intention healing. D. First intention healing. Your 5 seconds starts now. Alright, answer is sabay-sabay, letter A. Perfect. Second intention healing. When wounds dehisce, they will allowed to heal by secondary intention. Wound dehiscence. Anong key term mo dito? Edges are not surgically approximated. That's basically the definition of wound dehiscence. Wound dehiscence. Okay? Next. Board exam type of question number 36. An 80-year-old male client is admitted to the hospital with a diagnosis of pneumonia. Nurse Oliver learns that the client lives alone and hasn't been eating or drinking. When assessing him for dehydration, Nurse Oliver would expect to find A. Hypothermia, B. Hypertension, C. Distended neck veins, D. Tachycardia. Your 5 seconds starts now. Time's up. Answer is D. Tachycardia. With an extracellular fluid or plasma volume deficit, compensatory mechanism stimulates the heart, causing an increase in heart rate. Alright? Naku, nakaka 50 minutes na tayo. Teka lang, hihinga lang ako. 50 items ito. Sa mga susunod, gagawin ko na lang to mga 30 items. Para focus tayo sa rationalization, okay? Okay, mag-alala, dalasan natin to hanggang sa Mayo, hanggang sa madagdagan kasi hindi lang naman may December takers din tayo. Huwag ka mag-alala, kalma ka lang, ha? Ngayon ko lang na-realize, nakakapagod pala ito, nakakatuyo ng lalamunan. But anyways, I'm doing this for the love. Labanan lang natin, pusuan lang natin yan. Proceed na tayo. Board exam type of question number 37. The physician prescribes meperidine, Demerol, 75 milligrams IM every 4 hours as needed to control a client's post-operative pain. The package insert is meperidine, 100 milligrams per ml. How many milliliters of meperidine should the client receive? Is it A, 0.75, B, 0.6, C, 0.5, D, 0.25? Your 5 seconds starts now. Challenging ito. Alright, time's up. Challenging kasi you need to compute. Pero kung hindi mo naman kaya ng 5 seconds, I won't judge you. I-pause mo tapos balikan mo ulit itong video na to, okay? But the answer is letter A, 0.75. To determine the number of milliliters the client should receive, the nurse uses the fraction method in the following equation. Now, papakita ko sa inyo, okay, mag-alala. Next slide tayo. Now, to solve for x, cross-multiply the following. 75 milligrams times 1 ml is equals to x ml times 100 milligrams. So 75 is equal to 100 x. 75 over 100 is equals to x. So 0.75 ml or 3/4 ml is equals to x. Simple. Alright? So ito, may picture din dito para matulungan ka. Gamitin nyo itong mga visuals ko na nilagay dito sa dito rationalization at sa video rationalization na to para mas lalo mag-stick sa'yo yung idea, okay? Alright. Question number 38. My client with diabetes mellitus is receiving insulin. Which statement correctly describes an insulin unit? Correctly describes positive statement, negative statement, positive statement. Okay? So lahat ito ay negative. Isa lang dyan ang positive. Alin doon na ang correct? Ito correctly. Mag-ingat ka dyan sa mga ganyang klaseng tanong ha. Letter A, it's a common measurement in the metric system. B, it's the basis for solids in the avoirdupois system. C, it is the smallest measurement in the apothecary system. D, it's a measure of effect, not on a standard measure of weight or quantity. Your 5 seconds starts now. Time's up. The answer is letter D. It's a measure of effect, not a standard measure of weight or quantity. An insulin unit is measure of effect, not a standard measure of weight or quantity. Different drugs measured in units may have no relationship to one another in quality or quantity. Board exam type of question number 39. Nurse Oliver measures a client's temperature at 102 degrees Fahrenheit. What is the equivalent centigrade temperature? Conversion ng Fahrenheit to Celsius, nurses, ang tanong. A, 40.1 degrees Celsius. B, 38.9 degrees Celsius. C, 48 degrees Celsius. D, 38 degrees Celsius. Your 5 seconds starts now. Time's up. The answer is letter B. Pumipiyok pa ako. 38.9 degrees Celsius. Papakita ko sa inyo yung conversion. Ito siya. To convert Fahrenheit degree to centigrade, use the following formula. Degree Celsius is equal to, open and close parenthesis, degrees Fahrenheit minus 32, open and close parenthesis, divided by 1.8. Degrees Celsius is equal to, open and close parenthesis, 102 is minus 32, divided by 1.8. Degrees Fahrenheit is equal to 70 divided by 1.8. Degrees Fahrenheit is equal to 38.9 Fahrenheit. Degrees Fahrenheit. Okay? Let's proceed. Board exam type of question. Nako, last 10 questions na lang to, nurses. Kalma ha. Board exam type of question number 40. The nurse is assessing a 40-year-old client who has come to the physician's office for his annual physical examination. One of the first physical signs of aging is A, accepting the limitations while developing assets. B, increasing loss of muscle tone. C, failing eyesight, especially close vision. D, having more frequent acne or aches and pains. Your 5 seconds starts now. Alright, nurses, time's up. The answer is letter C. Nasaan na ba yung ano ko? Eto, C. Failing eyesight, especially close vision. Failing eyesight, especially close vision, is one of the first signs of aging in middle life. So, kailan to nagsistart? Age 46 to 64. More frequent aches and pains begin in the early-late years. Pag sinabing early-late years, anong age to? Age range 65 to 79. Increase in loss of muscle tone occurs in later years. Anong age? 80 and older, 80 and above. So the answer is letter C. Nurses, nalalapit na tayo. 10 more questions ha. Gusto ko lang malaman mo kung ano man na maging score mo sa baba, i-comment down mo. Dito sa exam na to, i-comment down mo sa baba ha, para ganahan akong gumawa ng mga magdagdag ng videos dito sa ating nursing test bank. Okay? Alright. Next, the physician inserts a chest tube in a female client to treat pneumothorax. Nagkaroon ako ng discussion about sa pneumothorax. Gumawa ako dyan ng nursing care management under ng medical surgical nursing. Diniscuss ko yun to the T. Panoorin mo. The tube is connected to water seal drainage. The nurse in charge can prevent chest tube air leaks. Prevention ng alin? Chest tube air leaks by A. Checking and taping all connections. B. Checking patency of the chest tube. C. Keeping the head of the bed slightly elevated. D. Keeping the chest drainage system below the level of the chest. Your 5 seconds starts now. Alright, time's up. Letter A. Checking and taping all connections. Air leaks commonly occur in the system isn't secure. Checking all connections and taping them will prevent air leaks. The chest drainage system is kept lower to promote drainage, not to prevent leaks. Air leaks ang usapan, kaya checking and taping all connections. Alright? Board exam type of question number 42. Nurse Trish must verify the client's identity before administering medication. She is aware that the safest way to verify identity is to... Anong tinatanong dito, mga... naalala mo yung rights of medication? Or drug administration natin. Ito yon. A. Anong tanong? Safest way to verify identity is to... A. Check the client's identification band. B. Ask the client to state his name. C. State the client's name out loud and wait a client to repeat it. Sapukin kita. D. Check the room number and the client's name on the bed. Your 5 seconds starts now. The answer is A. Nako, maraming umapila. Maaring sinagot nyo dito as the client to state his name. Okay? Safest way. Papaliwanag ko kung bakit A. Check the client's identification band. Checking the client's identification band is the safest way to verify the client's identity because the band is assigned on admission and isn't be removed at any time. If it is removed, it must be replaced. Asking the client's name or having the client's repeated his name would be appropriate only for a client who's alert-oriented and be able to understand what is being said. Okay? But isn't the safe standard of practice. Names on bed aren't always reliable. Pwedeng mali mo, lumipat yung pasyente mo. Paano kapag confused, lethargic ang pasyente mo? Paano mo i-check yung identity ng pasyente mo? So the safest way, yes, safe ang pagtatanong na pangalan pero mas safest yung identification band kasi hindi naman yung tinatanggal. At kung tinanggal man, papalitan yon agad-agad. Binibigay yon sa the moment na ma-admit ang pasyente. From ER or meron kang admission, meron kaagad na identification band. Okay? Wag na umapila, yun na yun. Question number 43. The physician orders dextrose 5% in water, 1,000 ml to be infused over 8 hours. The IV tubing delivers 15 drops per ml. Nurse John should run the IV infusion at the rate of IV infusion rate calculation. A. 30 drops per minute. B. 32 drops per minute. C. 20 drops per minute. D. 18 drops per minute. Your 5 seconds starts now. Pause mo baby ha, hindi kita masyadong challenge yan ha. Pero i-pause mo, alam ko na medyo it will take time for you to compute. No rush. But let me go back after 5 seconds ha, kasi medyo mahaba na tong video natin ha. Now, answer to this question is letter B, 32 drops per minute. Why? Papakita ko sa iyo yung computation. Giving 1,000 ml over 8 hours is the same as giving 125 ml over 1 hour. Yung 1 hour na yon, ilang minutes ba sa isang oras? Diba 60? Find the number of milliliters per minute as follows. Now, 125 per 60 minutes is equals to X per 1 minute. 60 X is equals to 125 is equals to 2.1 ml per minute. To find the number of drops per minute, here's what you're gonna do. 2.1 ml over X GTT is equals to macro drops is equals to 1 ml per 15 GTT. X is then equal to 32 drops per minute or 32 drops per minute. Macro drops. Ito rin to, calculating IV drip rates. Nandito siya. Sana ma-appreciate mo yan, ha? Okay. Board exam type of question number 44. If a central venous catheter becomes disconnected accidentally, what should the nurse in charge do immediately? Immediate action mo kapag na-dislodge ang iyong CV, central venous catheter. Is it A, clamp the catheter, B, call another nurse, call the physician, letter C, or D, apply a dry sterile dressing to the site? Your 5 seconds starts now. Hindi mo sasagutin ang call other nurse. So taka nagpanic ka, call the physician, wala kang ginawa. You are being left with two choices. Clamp the catheter, apply dry, sterile dressing to the site. The answer to this, nurses, is A. Now, bakit? If a central venous catheter becomes disconnected, the nurse should immediately apply a catheter clamp if available. If a clamp isn't available, the nurse can place a sterile syringe or catheter plug in the catheter hub. After cleaning the hub with the alcohol or providone iodine solution, the nurse must replace the IV extension and restart the infusion. No, ang sterile dressing, dry sterile dressing, okay? Clamp the catheter. All right, board exam type of question number 45. A female client was recently admitted. She has fever, weight loss, and watery diarrhea, is being admitted to the facility. While assessing the client, Nurse Hazel inspects the client's abdomen and noticed that it is slightly concave. Additional assessment should proceed in which order? Ang daming history ng tanong, hindi ba? Pero ang tinatanong lang naman sa'yo dito ay yung order ng assessment mo ng abdomen. Yun lang yun. Nasaan na yung abdomen dito? Ito Ayan. So paano ka mag-nursing assessment ng iyong abdomen? Anong order? A, palpation, auscultation, and percussion. B, percussion, palpation, and auscultation. C, palpation, percussion, and auscultation. D, auscultation, percussion, and palpation. Your 5 seconds starts now. Nursing 101 to MCN. Diba, ni-ret din pa natin to. Tapos na yung 5 seconds. The answer is D. Alam mo na. Auscultation, percussion, and palpation. The correct order of assessment for examining the abdomen is inspection, auscultation, percussion, and then palpation. The reason for this approach is that the less intrusive techniques should be performed before the more intrusive techniques. Percussion and palpation can alter natural findings during auscultation. Why? Because it can increase bowel movements. So, hindi na magiging accurate mo kapag hinuli mo ang iyong auscultation, maaaring na-stimulate na yung GI mo, yung GI ng pasyente mo. Kaya hindi na yun. Pwede magkaroon ng false positive findings or result. Okay? So, letter D. Board exam type of question number 46. Nurse Betty is assessing tactile fremitus in a client with pneumonia. For this examination, Nurse Betty should use sa pag-a-assess ng tactile fremitus, ano ang gagamitin ng nurse? Fingertips, B, finger pads, C, dorsal surface of the hand, D, ulnar surface of the hand. Your 5 seconds starts now. Time's up. Niret them natin to. Letter D. Ulnar surface of the hand. The nurse uses the ulnar surface or ball of the hand to assess tactile fremitus, thrills, and vocal vibrations through the chest wall. The fingertips and the fingertips and finger pads best distinguish texture and shape. The dorsal surface best feels warmth. Okay? Let's proceed. Board exam type of question number 47. Which type of evaluation occurs continuously throughout the teaching and learning process? Is it A, summative, B, informative, C, formative, and D, retrospective? Your 5 seconds starts now. Time's up. The answer to this question is letter C, formative. Formative or concurrent evaluation occurs continuously throughout the teaching and learning process. One benefit is that the nurse can adjust teaching strategies as necessary to enhance learning. Summative or retrospective and evaluation occurs at the conclusion of the teaching and learning session. Informative is not a type of evaluation. Answer is formative. Board exam type of question number 48. A 45-year-old client has no family history of breast cancer or other risk factors for this disease. Nurse John should instruct her to have mammogram how often. Kapag, ang tanong dito guys, yung frequency ng paggagawa ng mammogram ng isang pasyenteng wala namang familiar history ng breast CA at wala ring other risk factors ng breast CA. So ano yung frequency na isasuggest mo sa pasyente mo? Is it twice per year, once per year, every 2 years, once to establish baseline? Your 5 seconds starts now. The answer is letter B. Once per year. Yearly mammogram should begin at age 40 and continue for as long as the woman is in good health. If health risks such as family history, genetic tendency, or past breast cancer exist, more frequent examinations may be necessary. Alright, parang annual check-up lang ang dating. Next, board exam type of question, number 49. Last 2 questions na. A male client has the following arterial blood gas values: pH of 7.30, partial pressure of oxygen of 89 millimeters of mercury, partial pressure of carbon dioxide 50 millimeters of mercury, and bicarbonate of 26 mex per liter. Based on these values, Nurse Patricia should expect which of the following condition. Kung pinanood mo yung latest upload ko, yung part 2 ng ng aking mga lab values, diniscuss ko ang normal values nito. Mas lalo mo masasagot itong tanong na to kung pinanood mo yon. Okay? Kasi malalaman mo kung may deviation sa normal ba based from the values given sa question na ito. Is it A, respiratory acidosis? Is it B, respiratory alkalosis? Is it C, metabolic acidosis? Is it D, metabolic alkalosis? Nurses, your 5 seconds starts now. Alright, the answer is letter A, respiratory acidosis. Ito yung mga signs ng respiratory acidosis mo, ha? Now, the client has a below normal or acidic blood pH value. Ano ba yung normal blood pH value mo? 7.35 to 7.45. This one is clearly acidic. And an above normal partial pressure of arterial carbon dioxide. Carbon dioxide mo, ang normal niya is 35 to 45. Ang normal value mo naman ng PCO2 is 80 to 100 if I'm not mistaken, millimeters of mercury. Tama? Now, partial carbon, saan na ba tayo? In respiratory alkalosis, the pH value is above normal and the PCO2 or partial pressure of carbon dioxide value is below normal. In metabolic acidosis, the pH and bicarbonate values are below normal. In metabolic alkalosis, the pH and bicarbonate values are above normal. Alright? So this one is respiratory acidosis. Last question, board exam type of question. Nurse Len refers a female client with terminal cancer to local hospice. Hospice. Ano una pumapasok sa isip mo pag hospice? What is the goal of this referral? A, to help the client find appropriate treatment options. B, to provide support for client and family in coping with terminal illness. C, to ensure that the client gets counseling regarding healthcare costs. Gigigil ako sa'yo. D, to teach the client and family about cancer and its treatment. Your 5 seconds starts now. Galingan mo. Alright, the answer is letter B. To provide support for client and family in coping with terminal illness. Hospice care, terminally ill patients na po nilalagay dyan, mga skilled nursing facility. Hospices provide supportive care for terminally ill clients and their families. Hospice care doesn't focus on counseling regarding healthcare costs. Most clients referred to hospices have been treated for their disease without success and will receive only palliative care in the hospice. Yes! Whoo, nurses! Tapos na nga tayo sa ating 50 questions. Ano to? PNLE sets of questions, fundamentals of nursing practice na to. Now, let me know if you have other nursing. Huwag ka mag-alala kasi balak mong i-cover yung other questions natin na matatagpuan mo sa OB, na pwede mong maano sa pedia, sa community, pati sa saan pa ba? Sa medical surgical, sa pharma, lahat ng mga klaseng possible questions ilalagay ko doon, and magdadagdag tayo ng video sa ating nursing test bank, okay? Mga other subjects. Huwag ka mag-alala ha, kalma ka lang, mag-isa lang ako. Abangan mo yung mga next nating upload dito sa aking channel about sa nursing test bank, kasi ipapromise ko sa'yo na hindi ka lang mapapamiliarize sa mga questions. Ang goal natin dito is malaman mo yung rationalization, okay? Now, pakilagay ang score nyo sa baba kasi I would really like to know. Be honest about it. Don't be shy. Hindi mahalaga na mataas ang score mo. Ang mahalaga dito, ang point nito ay malaman mo again yung rationalization para pagdating mo sa board exam, kapag sa araw ng board exam naka-encounter ka ng kamukhang tanong, yung relative niya, alam na alam mo kung paano siya sasagutan, kasi pwede nilang baguhin yung tanong, pwede silang gumamit ng ibang words pero same thought, okay? Now, maraming salamat po. Ipamalita mo na sa Radyong Sira, ang pinakabago, pinakamasaya at pinakalibreng review center sa balat ng YouTube. Thank you so much, nurses, for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. #TeamKulta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box, or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. By the way, let me encourage everybody to please follow and like my Facebook page. I'm going to put it here right now. Yes. Ilalagay ko rin yung pinaka link doon sa description box ng lahat ng social media accounts ko. Kaya naman, check out mo na yon. I'll see you again.